So excited to be joining you today. As many of you know, last week we officially launched our My Time, My Space, My Pace campaign that aims to raise awareness of the disproportionate impact of the COVID-19 pandemic on women's physical and mental health. And what we really want to do through this campaign is create a safe space for conversation, for shared experiences, and just for talking about how we feel about the impact of the past 2 years, which has been pretty huge, isn't it? Now, a huge number of you have taken part in our survey, COVID 2 years on, which was absolutely brilliant. Thank you to everyone who took part. The response was absolutely overwhelming, and we're still working through the results, and we'll share those with you very, very soon. But it just proved to us really, your response just proved to us really how much you guys want to talk about this. It's not something that's being talked about widely. The world seems to be moving on, and we're all still carrying that incredible load of the trauma that we've all collectively experienced over the past couple of years. So the great news is we're going to be talking about it. We've got lots of stuff planned over the next couple of months. And today is the first session where we're going to try and create a bit of space, as I say, to talk about the things we're all feeling and to just try and make sense of them a little bit and think about how we might move forwards. Now, with that in mind, I'm absolutely thrilled today to be joined by Dr. Ahmed, a psychologist, academic and psychotherapist who's here to talk to us about the COVID-19 pandemic and the impact it's had on women's mental health. Dr. Ahmed joins us from the University of Bristol. So she's here with us in Bristol, where she's a lecturer in social sciences and a leading COVID expert who's been commenting on behavioural change and the rise in mental health conditions across the country since the start of the pandemic. Nearly welcome.
Hello there.
Maybe I can loop you in.
Hi, Mel.
Everyone see. Okay. I saw your face on the screen then for a second. Are you there?
I am here.
So brilliant. Okay, I never quite know what's going to happen with the technology. So welcome to the session today. Perhaps you could start by telling us a little bit about the work that you've been doing.
So I've been looking at a lot of the research that's been coming out around mental health and anxiety and how it's been presenting in the population during COVID and after. And so in my work as a psychotherapist, I've been seeing it present in the people that I work with. As a lecturer, we've seen a real rise in anxiety amongst the student population and amongst the staff as well. So like many of the women that you'll be having in your group, our lives completely turned upside down with the pandemic. And everyone is expected to almost carry on as normal. So you were still having to work, you were still having to look after your family, still having to do everything, but in the context of something that you've never experienced, almost carry on as normal. So you were still having to work, you were still having to look after your family, still having to do everything, but in the context of something that you've never experienced, almost carry on as normal. So you were still having to work, you were still having to look after your family, still having to do everything, but in the context of something that you've never experienced, almost carry on as normal. So you were still having to work, you still having to look after your family, still having to do everything, but in the context of something that you've never experienced, almost carry on as normal. So you were still having to work, you still having to do everything.
I've just had to pause it because I literally am getting a really big echo. Are you as well?
Yeah, I'm getting probably not as loud as you, but I can hear myself. Yeah,
I literally cannot. I cannot hear what's going on. I can hear myself talking over you and then you talking over yourself. I've just paused it on Facebook. Hold on one second. Sorry. Hi everyone, it's Mel Bound here. I'm the founder of TMR. Thank you so much for joining us today. This is our second attempt. We did try to stream live into Facebook. Technology didn't quite go our way. So what we're going to do is give it another go and record on Zoom and share the link with you afterwards. So I'm really thrilled to be here today. This is a campaign, the launch of a campaign that I feel really passionately about after 2 years of what can only be described as world upending trauma with the COVID-19 pandemic. And it feels very much like the world is moving on. And I don't know about you, but I don't quite feel ready to do that yet. I feel like it's really important that we stop and take a moment and reflect on everything that's happened over the last couple of years, and create the space for us all to share our experiences and talk about the things that we've found difficult and traumatic, and really think about how we want to move forwards from here. So last week we officially launched our My Time, My Space, My Pace campaign. The goal of the campaign is to raise awareness of the disproportionate impact of the COVID-19 pandemic on women's physical and on their mental health, and to create a space, as I say, for these really important conversations, for these shared experiences, and to really reflect on the impact of the past couple of years, which has been huge, hasn't it? Now, a huge number of you took part in our survey, COVID 2 years on, telling us about the impact of the pandemic on your lives. And the response was absolutely overwhelming, which just proved to us how much you guys want to talk about this. It's not something that's being talked about really widely. It feels like the world is moving on while we're all still carrying the incredible load of the last couple of years. So we'll be sharing the results of the survey very soon, but there's some pretty hard-hitting stuff in there, particularly around the impact of the pandemic on our collective mental health, with 83% of you saying you've seen a negative impact on your mental health due to the pandemic. 83%, which is absolutely massive. And 55% of you told us that the pandemic has had a negative impact on your physical health as well, with 51% saying you've lost a sense of well-being, 83% saying that the impact of the effects of the pandemic are still being carried with you today. And I can totally relate to all of those numbers. So today's session is the first in a whole series that we're planning, where we can create a bit of space to talk about these things that we're obviously all feeling and try to make sense of them a little bit, and also work out together how we might move forwards. So with that in mind, I'm absolutely thrilled today to be joined by Dr. Ahmed, a psychologist, academic and psychotherapist. And she's here to talk to us about the COVID-19 pandemic and the impact that it's had, particularly on women's health. Dr. Ahmed joins us from the University of Bristol, so is with us here in Bristol, where she's a lecturer in social sciences and a leading COVID-19 expert. She's been commenting on behavioural change and the rise in mental health conditions across the population since the start of the pandemic. Welcome again. We're going to give it another go, aren't we? We'll see how it goes. Could you start by telling us a little bit about the work you've been doing over the past couple of years?
So we've been looking at the rise in mental health conditions across the population and how COVID has impacted the general population since the start of the pandemic and actually going on. And it's been fascinating to see those changes and to see the levels of anxiety. The first part of the pandemic, actually, there's still a novelty about it. It was scary and frightening, but there was also, oh, we don't have to go into work. There's something quite exciting. We get to spend more time with the kids. It's quite a nice thing. But very suddenly and very quickly, that turned into, when is this going to end? How am I supposed to fit everything in? Yeah. And those boundaries began to blur very quickly of home and work. And so what we found actually is people work much more during the pandemic than they were when they were going into work. So that break that you have, the commute, that's such an important part for your process, for your brain to process and to begin to switch off. And if you don't have that, even if you're saying, right, I'm switching off at 5 and I'm going to get on with house stuff and the kids, your brain hasn't had the opportunity to really unwind itself. So you're carrying work into that space. And as a psychotherapist, I've been seeing people come into to work with me and talking about the stress that they can't seem to shake, a feeling of just feeling very unsettled and not knowing what that means. And people are really reevaluating what it means for their lives. And so lots of things are going on for people. And again, in universities, we've got students who are coming into university who didn't get to sit their exams. And again, initially you thought, well, great, I don't have to sit an exam. So for young people, that was a great feeling. But actually what we're seeing with students is that they don't feel worthy. They think, well, I haven't proven myself. I haven't proven that I can get those grades to get into university. And so it's really affecting their self-esteem. So across every age, and we know that last year, the children's word of the year was anxiety. So very young children have chosen that. That's the word that has the most relevance to them. And it's really staggering. And we've seen again, antidepressants being increasingly allocated to prescribed to young children under the age of 10. So across the entire population, we're seeing a real rise in mental health issues.
Wow. I mean, I got goosebumps then when you mentioned that kind of word of the year for children. And that's absolutely devastating, isn't it? For me as a mum to hear that. And actually, I've seen that in my own family as well. One of the things that we've been talking about within the TMR community is this idea of collective trauma. You know, this is something that's happened to us all, isn't it? No one's really escaped the impacts of the past couple of years. Could you talk a little bit to that idea of collective trauma, what it means, and how we can apply it to the, you know, what we're talking about in terms of the pandemic?
Yeah, a collective trauma is exactly as you said, Mel, something that happens to all of us. So we've all shared the experience, and none of us have been able to escape the impact of the pandemic. But the difference is that now we're supposed to come out of it. And like you said in introduction, apparently it's over. But for many of us, we're still really worrying about what it means for us. Some people are really joyous about not having to wear masks. They found them restrictive and are really happy to be able to go and socialize more and places are open because it helps their mental health. But for other people, that's actually really quite stressful to go into crowded places and knowing that the pandemic is still with us and that we have to find ways to live with it. So that collective trauma, the initial part, when you're going through it together, there is a sense of solidarity. And we saw that with the clap for carers. We saw that with that sense of community that was beginning to rise, and people got to know their neighbors. And they'd often say, well, we've lived on the street for 20 years and we didn't know people, and now we know lots of people on our street. And so that was really positive for people. But as we're emerging from it, people have been impacted in different ways. All of us have experienced loss at some level. So we've lost, like you say, our sense of well-being, our health, our ability to, our social networks as well. And it's quite stressful to know how to go back and begin to engage in the social interactions again. We've almost lost the skill to do it.
Yeah. Actually, a lot of people have shared with us that they've kind of experienced a shift in extroversion to introversion. So they might have started the pandemic as an extrovert, and they've emerged from the pandemic as actually quite a major introvert. So when they're going into social situations, they're quite quickly feeling drained of energy and having to spend time talking to other people in person. Is that something you've seen as well?
Yeah, absolutely. Really important. And it's, if you think of it in terms of, as runners, your exercise, if you don't exercise for a long time, then when you get back into it, your energy levels are just low. Your body can't do it. So it's about reintegrating and almost teaching yourself how to, and allowing yourself enough time and a break in between and resting from the social exertion that you have. Otherwise, you find yourself just completely swiped of any energy and begin to think, I can't go out in the world at all. And the fact is you can, but we just need to give ourselves that level of time to adjust again. And then perhaps we have changed, and perhaps introversion is our thing, and we don't want to spend that level of time. And that again is something I'm seeing a lot with people with. Some people are really going back into society and want to go out with their friends, and other people are coming and saying to me, I don't know if I belong in this friendship group anymore. I don't know if this is the space for me, because I just want to settle in front of the TV with a takeaway, and I'm happy with that. That's my evenings, that's my weekend. My relaxed time is with my family and doing nothing, because actually going back, adjusting back to working in the office 1 or 2 days a week, that's been exhausting for me. So socializing is going to have to be pushed down the agenda.
Yeah, oh God, I can totally relate to that as well. One of the things that's been really compelling in not only our own research, but the kind of wider research looking at how the pandemic has affected women disproportionately. I wondered whether you could talk to that a little bit about why it's so disproportionately affected women. What have you seen in your work?
It's really interesting, because initially we thought, Well, women, we know from just the literature and all the things that be familiar to everyone that's watching this, is that women do a lot of the household work. So when it came to working from home, you were doing your job, but you were also doing the lunches that people might have ate outside, or things you could have prepared the night before. And you were trying to keep on top of all of the household things, managing the children's homeschooling if you had kids. So a lot of the time, that all of the duties that women had to do within their home, they began to be spread in an uneven way. So we reverted almost back to being a sort of 1950s housewife plus being a 1980s power worker as well. And you had to manage those and learn new technology and be able to do all of the things that you were expected to do on top of you trying to adjust to a pandemic. What we've seen in the literature more recently, though, is that there are genetic differences as well. So with women and with sort of things like our hormonal differences, that women might be more prone to things like long COVID. And we don't really understand why, but we're seeing that trend coming along. And some of that will be about our genes and our hormones as well. And so women are being affected disproportionately across all levels, both sort of physiologically, but also socially and culturally as well.
Interesting. Actually, my next question was going to be around hormones, because one of the kind of hot topics of conversation within the TMR community, actually even before COVID, was unsurprisingly was hormones and perimenopause and menopause, increasingly so actually. And anecdotally, we've been seeing stories of women who are in the perimenopause experiencing the symptoms of COVID in a more dramatic way, and then taking longer to recover. And I wonder whether there's anything in the research that can kind of explain as to why that's happening, or is that still something that's being worked out?
Still very early working it out, but definitely it's been caught up in the literature. So what we were seeing maybe early part of the pandemic, sort of 6-7 months in, was that women were reporting this, but it wasn't being picked up by the data because the markers they had, unsurprisingly, usually defined by men. And so this wasn't something that they'd even thought about including. And so, but there were other spaces where people could go and list their symptoms that weren't characteristic symptoms, that weren't being picked up by the main data sets that were asking people to list their symptoms. And this became something that people were talking about more and more, that people's ovulation cycles changed, their periods changed, and particularly when it came to perimenopause, suddenly people were going from slightly irregular to really irregular periods. And so recently, in the last sort of 6 months or so, there's been a bit more research around that, trying to understand what is going on. And there has been research that's found that women who are taking HRT tend to have a better recovery from COVID if they get it, compared to women who aren't on that hormone replacement. So again, we're still not sure why, but we are seeing that's only in one study. So again, the authors are saying, look, we have to be cautious about this, but there does seem to be a bit of a trend here. So that then will spark other studies and get people to look at where take into account these other factors as well. Because often people will ask women about their menopause or about their hormonal cycles at all.
Yeah, I mean, that sounds familiar, but I mean, interesting to think that that we're just at the start of understanding what's going on, but hopefully, well, I think just recognizing that it is a thing is really important for women, because I know a lot of women have been feeling this way, that it's been affecting them more than maybe the men in their families. And hopefully over the coming months and years, we'll understand a little bit more what's actually happening there.
Definitely. And I think that it's always a stressful time. Perimenopause is stressful for just, even without a pandemic, because the onset of it is almost quite insidious, that you just, what's that? And you don't really pick it up until you yourself have undergone quite a lengthy period of time. And often the irony of perimenopause is that women will think they're going into perimenopause long before they've actually reached it. But when you're actually in that space, because of the subtle differences, you don't necessarily pick that up. You attribute it to stress. You think, oh, well, there's so many other things going on in my life. And then you don't have that reason. And once you've got that reason, a lot of things begin to fall into place, and you go, okay, now this makes sense. Now I can understand why my energy levels are all over the place, why my body temperature is fluctuating. And some of the symptoms of COVID as well have been little things like that, about slight body fluctuations in temperature. And so people begin to get really uncertain about, is it this, or is it just a symptom of long COVID that's settled in, or am I in perimenopause? So really confusing times.
I mean, I think we could do a whole session just on this, actually, because it's something that is a big topic of discussion. And thinking about my own experiences actually of COVID and of perimenopause, the symptoms are actually very similar.
Yeah.
And so that kind of, like you say, creates that level of confusion, but also there's not really the space for women to talk about that. So I think it will definitely come back to that topic. It's something that's, I think, going to be really interesting for women. Moving on to, you mentioned in your intro about the kind of the rise in mental health conditions, particularly in terms of anxiety across the population. And I wondered whether you could talk to that a little bit, just what you're seeing, how it's manifesting, and just what you think about it all.
It's manifesting in a range of different ways, and it's really personal. And I think that's the most important thing. And I think that's one of the brilliant things about your group, is giving women that space to talk about what it means to them. And actually, when you strip away the noise of it all, we're all going through a similar sense of really feeling uncertain, feeling scared, really worrying about, am I the only one this is happening to? Have I understood this correctly? Am I overreacting? And those are sort of the baseline things. And then they present in quite different ways for individuals. So people who are having to go back to work, often that will be the hook on which their anxiety sits. And so everything becomes about work, and they'll find themselves ruminating and catastrophizing about not getting a report in, not meeting a deadline. But actually, it's about all the other things in their life as well. It's about worrying about the kids resettling into school, and are they going to catch something? Are they going to bring it back home? Do you have a relative who might be clinically vulnerable? Do you have the capacity to take time off if somebody does fall ill? So all of these things are swimming around in our head, but it tends to latch onto one thing, and that thing might be different for everyone. And for other people, it will be, I've put on weight during the pandemic, I can't go back into the office, it will be awful. And it begins to really settle in, and then the negative thinking that begins to set in, a cycle of not liking yourself, really digging into people's self-esteem. And we know that women's self-esteem generally is much lower than men's, and then people tend to work through that and get to a good place. And then what the pandemic has done, it's lowered all of our defenses so much that it kicks in and almost drags that low self-esteem back out. But, oh, I remember this. This is something that's quite familiar to me. I know, I'll go back into that brain loop. So as much as the cognitive, the front part of our brain, the conscious, the really thinking alert part knows that actually we don't want to be low in our self-esteem. We've done lots of work on this. We are valuable, all of those things. But the previous parts where we just spent so long really struggling with ourselves, our brain still remembers those patterns, and it can be quite comforting to go back into that, because we've got so many other things to worry about.
Gosh, yeah, I totally relate to that. And could you talk a little bit to how, I think obviously we know that this has disproportionately affected women, but I know a lot of the women in our community have also got concerns about their children's mental health. So I wonder whether you could talk to a little bit about, you mentioned that the words of the year being anxiety, which I mean puts horror in my heart, but I wonder whether you could talk to that a little bit, and just some of the things that we can look out for as mums, and also some of the coping mechanisms that we might be able to use with our children if they're going through that sort of those sorts of issues.
Yeah, it's been such a tough time for young people. Just being apart from their friends, that's been really difficult. And they're so important these years, that there are formative years. They're ways in which we learn about ourselves, we learn who we are, and we learn who we are separate from our family. And it's a really important part in our growth and our identity. And that's been taken away from children to a large extent. And they will necessarily pick up on the anxiety and the fear that's been just in society. And so they themselves won't really know how to navigate those situations. And again, we go back to school is open and masks aren't really mandatory in all places. But what if you do have a vulnerable family member or friend, and what if you do have parents who are concerned? So being able to navigate and balance that puts a bit of responsibility on children that often as adults we don't really see, because we're having those discussions and they're picking up on those concerns. But they're often the most powerless in society, because they can't go into a school and say, actually, I don't agree with this policy and I'd like to sit this, 2 meters apart, and can we have the windows open? They don't have the capacity or the ability to make those demands. And so they're finding themselves almost quite powerless in the school situation, but also coming home and thinking, God, have I brought something home? And there was a young girl that somebody had written about and shared a post on social media, who thought that they were responsible for the death of a parent because they'd brought COVID in from school. And so whilst the child hadn't had a terrible experience of COVID, the parent had caught it and had sadly died. But that guilt, and you can imagine that guilt that will sit with somebody for the rest of their life. And so we're seeing such a proliferation of different levels of stress and anxiety in young people. And then we've got, as you get slightly older, we've got people who are getting ready to sit their exams and without having had formal schooling in a long time. And there's been there's a huge difference, as you'll know. You've got a massive cohort of women that you work with across society. And so we don't have even distribution of wealth, of access to things like space to study in. And so we're seeing a real difference in children's achievements as they go back into school. So some children have been able to keep up with schooling. Other children, through no fault of their own, just simply haven't been able to. And that puts, again, added pressure on the children and can affect their self-esteem and well-being as well.
Yeah, I mean, interestingly, I had a conversation yesterday with a friend who's a deputy head, and she shared with me that some of the challenges in schools around bullying and instance of racism, for example, and they were trying to understand what it was that was happening, and they realized that actually the kind of time that the children had away from school, where there might have been an incident in the news, that they would put together some communication to go out to the parents about. They would run discussions in tutor groups so that children had the opportunity to ask questions and to have discussions around important topics. Those moments haven't happened because the kids have been their time in school has been so disrupted. And what's happened is that it's created, the knock-on effect has been an increase in incidents of bullying, in particular in terms of racism. And I thought that was really interesting, because it's all these kind of ramifications that you don't necessarily think about as a parent, that are kind of bubbling away in our children's brains and manifesting in all sorts of different ways.
And you're absolutely right. And we know with things like racism, the best way to combat that is just having conversations, is by meeting people who are different to you, whether it's any type of discrimination, LGBT, ageism, sexism. The more you communicate with people, the more you actually see that, we're really quite similar. And when you're relying on things like you're getting your news from the tabloid media, from social media, it is very algorithm dependent. And so you're being fed things that perhaps you wouldn't necessarily be looking at if you weren't in that space. And if you realize that actually most of my friends, the people I'm at school with, they're Muslim, they're Black, or somebody, I've got a teacher who's gay, somebody's got tattoos, and yet we all get along, we all talk to each other, then that's the way to eradicate discrimination and to really promote inclusion and belonging for people.
Yeah, absolutely. And talking about news, I mean, one of the things that's bubbled up in our community is this idea of, it's almost like anticipatory crisis, because there's so much bad news, isn't there? The last 2 years of all the news around COVID, and then more recently with what's happening in Ukraine and all sorts of other things around the world. And that is kind of creating this sense of fight or flight constantly internally for people. I wonder whether you could talk to that a little bit, and some of the things that women might be able to do just to reduce that feeling of fight or flight.
Yeah, really important to try and reduce this, because what could happen is that it could set off an immune system response, because there's only so much your immune system can take before it just gives up on you and says, I can't do this anymore. And what the pandemic has done is that, exactly right, that we're in this fight or flight system, we're in this hyper-vigilant state of what's next, what's going to be around the corner, because there's been one crisis after another that we've had to deal with. And it's just almost locked us into that system now of being ready to go, so that the next time something comes up, we're ready to fight. But actually what we're doing, we're exhausting our resources, we're completely depleting our energy by staying in this fight or flight. And it is exactly as will be familiar to lots of people. If you think about pre-pandemic, every time you book yourself on annual leave and go on holiday, the first 2 days, that's when your cold would set in. That's when suddenly you'd feel really exhausted and unable to do anything. Your body is waiting for a period, and it's not allowing you to rest because it's worrying about the next time something will happen. And so if you do find yourself able to rest and book a holiday, that's exactly what's going to happen, but at a bigger scale. The exhaustion levels will wipe out your energy completely. So being really mindful of trying to do things to try and break that cycle and to switch off the fight or flight response. And it's not easy to do. It's things around sort of looking around for things that you have and understanding that lots to be grateful for. Yes, there are terrible things that are happening, and there are things that you can do. So what can I do practically? So if I'm really worried about the war in Ukraine, I can maybe make a donation to a charity that will help people. So not everyone is in a position to house a Ukrainian family or anything like that, but there are things that we can do that will help the efforts. What can we do about just the next stage about going out? If I'm worried about going out in crowded places, what is it that's right for me? And what's right for me might not be right for you, might be different for everyone else. And it's about really focusing on what you can control and accepting what you can't. And even within families, we'll find the same thing. So, you know, you want family who might want to get together for Sunday dinner and decide to go to a pub, and other ways of managing that. The weather's getting a bit nicer now, so can we sit outside and just not be there for too long? Those kinds of negotiations and feeling confident in yourself to ask for your needs to be met. And essentially, as human beings, that's all that we want. We want somebody to go, okay, that's fine. No, I understand. I hear you, I see you. And I think that's one of the great joys of your group, is that people find each other and go, oh yeah, that makes sense. Me too. And that's all that we want. There's such a fundamental human need. Is a part of the first thing we need is safety and security and air to breathe. And what the pandemic did, it threw that. The air around us wasn't safe. We literally didn't know if we could go outside and breathe. And think about people washing their groceries when they brought that in. That's still with us. It hasn't gone away just because we're not doing it anymore. That's the stuff that's feeding into that hypervigilant loop for us. It's reminding us that at any minute we could go back there because it happened so suddenly. So reminding ourselves that actually now we know so much more about the pandemic than we did. Lots of people are vaccinated, so you do have defenses against it in a way that we didn't have before. And just reminding ourselves of all the things that we do have to protect ourselves. That's one of the key things. And I always go back to the basics. Try and sleep well. Try and get good nutrition in as much as you can, and try and get some daily exercise or get outdoors for some fresh air and keep hydrated. If you do those things as best as you can, about 70% of stress gets eliminated, because as soon as we're stressed, the first thing that tends to go is we start to not look after ourselves, not eat properly. Then our worries keep us up at night, so we're not sleeping properly. And you end up in this cycle that just perpetuates itself.
Yeah, and I think that's like going back to our early discussion, that's something that disproportionately affects women, isn't it? Because as women typically will look after everyone else around us first, and then realize that we're actually on our knees because we've not done any of the self-care things that you've just described. And that's absolutely what this campaign is about, I think, is that, you know, firstly, let's just stop and pause and actually acknowledge that this has been hard, and then think about the simple things that we can do that are about taking the power back to a certain extent, in terms of our own well-being, putting ourselves back to the top of that list, and thinking about, you know, what's possible now. You know, it might be different to what your routine or regime was pre-pandemic. Going out for a 10-mile run might seem completely out of reach right now, but going out for a 20-minute walk might feel okay. And it's like you say, it's about thinking about the things we can control, about doing those little things and trying to build those back into our daily lives. That's really what you're saying, isn't it?
Absolutely. And the analogy that's often used in these situations is the one of the oxygen mask on the airplane. You've got to do it for yourself first before you do it for anyone else, because you need to be at your best. You can't pour from an empty cup. So you have to have your own resources. And you have to think about, if you're thinking about comparing yourself to pre-pandemic, think about the time that was spent on commuting, the time that was spent on doing the things before then, and build that into excuse me, build that into your routine again. So allow yourself that half an hour or that 1 hour and do something for yourself, whatever that self-care looks like. So it's exactly as you're saying, a small walk is better than no walk. And there is a saying of, if something's worth doing, it's worth doing badly, because it's worth doing it. Doing it badly is better than not doing it at all. So if you're going to do some exercise, then just get off the sofa and just go outside for a little walk. That's better than not sitting there at all, not doing anything at all. So just think about, I just need to do it badly. I just need to, I can't be bothered to put the washing. Yeah, I can't be bothered to put the washing on, but you know what? I'll put it in the machine for now. I'll just end up throwing things in the machine until it gets full. And changing your attitude and reframing your thinking a little bit to show compassion to yourselves. And as women, I think that's one of the things that women don't do enough, is that they have so much compassion for everyone else, for their kids, their families, their partners, and even for other women. So in your groups, if somebody raises something, then the women around them will say, oh God, no, you're being too hard on yourself. Of course, that's ridiculous. But when it comes to applying that to ourselves, we just don't do it. So often thinking about, well, what would I say if I was talking to someone else, if it wasn't me? If somebody was telling me my situation, what would my response be? Yeah. And very often it's very different to what we tell ourselves.
Why do women find that so hard? Is there something in our brains that just makes that hard? Is it our makeup, or what is it that makes that so difficult for women?
It's very much about our socialization, and across all cultures we see this, that women are the nurturing ones, the responsible ones, the carers. And we know that I think about 70% of frontline workers, so nurses, midwives, just frontline reception staff, all of those people, they tend to be women. And so our job is to always be nice. The customer is always right. So, you're always having to be the first point of contact, be polite. You're teaching your children good manners. And so we're always socializing, instill that. And it's such a strong connection in our brains. And we say, sort of, when it comes to brain talk, what fires together, wires together. And so if you keep saying it, if you keep firing that line of, oh no, I've got to do right, I've got to look after somebody else, it's become such a strongly embedded pathway in our brain that it's very difficult to sort of say, actually, no, not now. I need to look after myself. And understand that people generally, the world isn't going to collapse, and people won't necessarily be offended if you say, I can't make that now. I'm sorry, that time doesn't work for me, because they'll understand. And often we think that people won't, and we just go over and above and beyond to accommodate people, then actually we're just really struggling ourselves.
Yeah, God, that's so true. I'm sure so many people listening are going to relate to that. Aside from the kind of sleep, nutrition, exercise message, what are the really top tips, simple things that women listening can go away and do after this session to start that process of taking back control of their own well-being?
Carve out time for yourself, and an hour a day, I would say. And that sounds horrific to some people. Some people will be listening and go, oh, that sounds doable. Other people will say, how? Where am I supposed to find this hour? I'll have to get up an hour earlier. No, you don't have to. There is a lovely Buddhist saying about how if you are very busy, that you should meditate for 20 minutes a day, unless you're very busy, in which case you should do it for an hour. And every time I say that, I can feel my anxiety rising myself, because I just think, how do you find the time? But it's finding some time and really forcing yourself to switch off and thinking about things like mindfulness. And you don't have to go on a big course to learn about mindfulness. It's really just about being where you are and focusing on what you can do now. So often we're worrying about things a week in the future or tomorrow or next day, thinking about what you can do now and literally being in the moment, taking some time out to just breathe, really small breathing exercises. And again, if you just for a minute do a breathing exercise where you breathe in really deeply, even if you're counting it for 4, boxed breathing is what we call it. You breathe in for 4, hold for 4, breathe out for 4, hold. And that for a minute will regulate your physiological system. Okay. So when you talk about the fight or flight, these are the things that you can try and do to disrupt that a little bit and bring you back to a place of calmness.
Now, I reckon everyone can do that. Just stand and breathe for a minute or two.
Absolutely. And make a list of things. And there's lots of things that, in the last 5 or 10 years, this notion of a bucket list that was very prevalent on social media. but it doesn't have to be. But make a list of positive things, because when our brain is in that positive mood, it again switches it from catastrophizing and thinking about the negative things. So things you'd like to do for yourself, things you'd like to do with your family, just positive things or positive memories. And then if you're feeling at a loose end or you're feeling overwhelmed, you can look over this and think, oh, actually, you know, that was a nice memory, or this is something I can do. Let's go and let's just go and walk around the park. It doesn't have to be a big run, or let me pull out these little, do some of that mindful coloring. And you can do that with your kids as well. You can spend some time together.
That's such a great message. I think sometimes there's this feeling that it has to be something big. If you're going to make that time for yourself, it has to be something big. But actually carving out those small moments and doing things that are actually very low pressure, that's actually achievable by anyone, isn't it? It's
so important. And again, as women, we put such pressure on ourselves that it's got to be meaningful. That unless I'm, you know, I'm somebody, I'm going to blow my nose, I'm really sorry. Unless I'm somebody, I do some sewing, and sometimes it'll be, oh, I've got to finish this entire outfit, and there's no point in me starting because I've put on weight, so I'll make it when I've lost weight, or it's going to take me days to make this dress, so I can't. And so you could go for long periods of time not doing anything, but actually you could pick something up and you could do some slow stitch, and again, straight lines of stitch across the fabric. It doesn't have to end up with a product at the end of it. It just needs to focus your mind. And it's the same thing with people who cook. They just think, well, I haven't got time to cook a lavish meal, so therefore I won't cook anything at all. I'll go really basic food. People who bake, so there'll be something that people enjoy doing that we just haven't given ourselves the permission to do. And so allow yourself that permission to whatever it is that you enjoy doing, playing around with makeup, painting your nails, whatever it is, to give yourself time to do that.
And that's quite an exciting thought, I think. I hope that's the message that everyone takes away today. Just finding that one thing that sparks a little bit of joy that doesn't take up loads of time. That's quite a good place to start after a long period of time of actually investing pretty much zero time into yourself. So thank you so much for joining us today. There's been so many golden nuggets that I'm sure people are going to be scribbling notes and thinking about things that they're going to do when they watch the session back. So thank you so much for taking the time to join us. Thank you everyone that hopefully is going to come along and watch the session from the recording. As I said at the start of the session, this is the first in a series of interviews that we're planning to do around this whole topic of COVID 2 years on. We hope you join in, and we hope that you get behind the ethos of the campaign and start to take back some of that time for yourself. Thanks, guys. See you soon.
Thank you.